name is Mark Mayo and I work at the Menzies School of Health Research in Darwin. The area of research is microbiology that I work in, and we work on a bacteria called melioidosis. It lives in the soil during the year, and during the wet season we get a lot of cases after the rains come in. So it comes to the surface, people get infected with open cuts and wounds, or they can breathe it in. What led me into research was an interest in medicine at first. I was just interested in health in general, but also had an interest in science, how the way the world works, how certain things work in the world. And so there was a traineeship at the Menzies School of Health, and I took that when I was 18 years old. And 25 years later, I'm still at Menzies and working in science. So we're trying to identify people with melioidosis a lot earlier. Otherwise, it can take up to 7 days, 5 to 7 days for them to be identified with melioidosis. Well, we're working on rapid detection techniques that might identify it as soon as they come in. Then they can get the correct treatment and we can reduce mortality from melioidosis. 10% of the cases we get die, and that's where we get 30 to 40 cases a year, so there's 3 to 4 deaths a year. Most people come out of ICU with the treatment that's been put in place due to research and clinicians working together. So the research that we're doing, what's really interesting, especially with melioidosis, is we work in the clinical environment, so we work at the hospital with patients. Half the patients we work with are of Indigenous heritage, and they're so sick when they come in that if we can treat them as soon as they come in, we can help them. So there's the clinical aspect. There's also the environmental aspect. So we've been going out to remote areas in the Northern Territory, and that's Aboriginal communities seeing if we can find the bacteria present in the environment. That way we know if people are coming in from those communities and they're sick, they may have melioidosis. And then we have the molecular and microbiology side of it. So we're actually doing whole genome sequencing work as well to identify if there's different strains and if there's different virulence factors, and hopefully that work will lead towards a vaccine. Follow what you're interested in. Say that if you're interested in science, work with it. The other thing that I found that helped me a lot was find other people that are interested in what you're doing as well, and work with them. I've got a really good mentor, but also I guess the other side of it is, study hard and keep learning. Quite a big pool of Aboriginal and Torres Strait Islander health researchers, a network from nurses to health workers through to scientists through to policy makers, to that whole spectrum, so that we're sort of taking in the factors that affect Indigenous people. I think it'll help direct research into those Indigenous areas.